Good morning, everyone. My name is Dr. Argie Rivera, and in this section, we will discuss the most common screening tools that we use in community mental health clinics. As you can see on my slide, this is from the National HIV curriculum. I am in no way affiliated with them. The only reason that I chose this website is because for me to be able to explain it thoroughly for you guys. And with that being said, let's start. So first and foremost, I want to remind everyone that this is not for you to diagnose anyone with generalized anxiety disorder or major depressive disorder or any other substance or alcohol use disorders. The reason that I am emphasizing this is because we always want to make sure that we practice within our scope, and we want to make sure that we also are assertive nurses, meaning we know what screenings or resources we can utilize for collaborative care. So the first one that I want to discuss is the Generalized Anxiety Disorder 2-item question, or the GAD-2. So the Generalized Anxiety Disorder 2-item is a very brief and easy to perform initial screening tool for generalized anxiety disorder. I also want to emphasize that you can use any language that you want to suit your population. So over the last 2 weeks, how often have you been bothered by the following problems? The answers can be not at all, or 0, several days, or 1, more than half the days, 2, or nearly every day, 3. So if I use my language, the Tagalog language, I will ask this as sa nakaraang mga 2 linggo, gaano ka na nababothered sa mga problemang ito? Ang ating sagot ay hindi, not at all, or hindi ka na problema, or hindi ka nababother. Several days, in 2 weeks, more than half the days is mas madalas, or dili everyday ay araw-araw. So first is feeling nervous, anxious, or on edge. So ninenervyos, anxious, or feeling mo on edge ka. Second is not being able to stop or control worrying. Hindi mo matigilang mag-isip, hindi mo matigilang mag-worry in that aspect. So as the nurse, what you need to do is you want to make sure you emphasize that the question always is asking for the last 2 weeks, and also to make sure to always remind the client about the scale. So first, if client John Doe answered several days lang po, or less than 50% in 2 weeks most of the time, so you click 1. If you ask number 2, not being able to stop or control worrying, and then Miss Jane Doe answered, sir, mas more than 50%, mas madalas, pero hindi naman araw-araw. So that's the +2. So if you noticed here, again, the reason that I like it is because it shows the answers, and at the bottom it shows how we can interpret the answers. So the GAD-2 score obtained by adding scores for each questions. So we got here 3 points for Miss Jane Doe. Interpretation is a score of 3 points is the preferred cutoff for identifying possible causes and in which further diagnostic evaluation for generalized anxiety disorder is warranted. So the other information in this slide or in this website are pertaining to ano ba yung mga nade-detect ng ating initial screening tool, sources, and also, of course, we want to make sure we acknowledge who the proponent of the tools that we're using. Going back to here, you can see that the second one under the mental health screening is the Generalized Anxiety Disorder 7 or the GAD-7. So the GAD-7 is a more thorough initial screening tool to check the generalized anxiety disorder. This is one of the tools that we use in the community mental health clinics. The GAD-2 and the PHQ-2 are mostly for primary healthcare clinics, pediatrics, OBGYN. So the GAD-2 and the PHQ-2 are more quick, brief questions. GAD-7 and PHQ-9 are more specific ones. Again, reminding all of our nurses that we always need to make sure we stick with our scope of practice. We don't want to go over beyond that. So, ano nga ba yung GAD-7 or Generalized Anxiety Disorder 7? So over the last 2 weeks, how often have you been bothered by the following? The answers can be not at all, several days, meaning less than 50% of 2 weeks, more than half the days, madalas pero hindi every day, nearly every day, araw-araw. The first one is feeling nervous, anxious, or on edge. Ninenervyos ka, anxious ka, feeling mo on edge ka. That's the question. Second is not being able to stop or control worrying. Hindi mo matigilang mag-isip-isip, hindi mo matigilang mag-worry about different things. Third is worrying too much about different things. So, for example, si Miss John Doe is worrying about anong kakainin nila during lunchtime, ano mangyayari sa anak niya pag uwi from school. Or kamusta ang bunso nila pag natulog na yung bunso nila. So worrying about things or worrying too much about different things that it's affecting daily living. Fourth is trouble relaxing. So for example, Jane Doe, has 3 children. They're all sleeping already, but still Miss Jane Doe cannot relax after that. So, nahirapang magnilay-nilay o magpahinga. Fifth is being so restless that it is hard to sit still. Sixth is becoming easily annoyed or irritable. Naiinis ka na mabilis, sometimes without any reason, sometimes it has its own reason. Mabilis ka mabwisit. Seventh is feeling afraid as if something awful might happen. So, for example, Miss John Doe is afraid that her youngest child will not wake up. So something like that. So again, nurses, I want to emphasize that the duration is only for the last 2 weeks, and the answers are not at all, as in 0, several days, meaning less than 50% of 2 weeks, more than half the days, madalas pero hindi naman every day, or hindi naman siya buong araw, and then nearly every day is araw-araw every day. So if you notice here, it has its own interpretation. So when scoring for anxiety disorders, a score of 8 or greater represents a reasonable cut point for identifying probable cases of generalized anxiety disorder. So ang score of 0 to 4 is what we call minimal anxiety. Score of 5 to 9, we call it mild anxiety. Score 10 to 14, moderate anxiety, and score greater than 15 is severe anxiety. So for what reason, so why do we need to understand that that we need to know the interpretation of the scores? So again, the goal is for us nurses to be assertive nurses, for us to make sure that we work collaboratively with the psychiatrists or the primary care providers in the clinics. And by being one, we need to understand the scoring. And also, aside from that, the corresponding meaning behind minimal, mild, moderate, or severe anxiety. So remember, it doesn't mean you're anxious. It's going to be an issue. It's usually followed by, is your anxiety hindering you from activities of daily living or functionality? Again, at the bottom, it says here, we have sources right here, and we also need to acknowledge the one who made the tool. So now we already discussed two mental health screening that you can utilize in your community mental health clinics or in your primary care clinics. The next one is the PHQ-2. So they're just going to remind you, nurses, that the GAD2 and the PHQ-2 are brief questions. It only has 2 questions, meaning these are the questionnaires or the screening that are mostly used in a non-behavioral health setting, primary care clinics, OBGYN clinics, cancer clinics, even in the emergency room. So because it's very brief, it has only 2 questions. The JD7 and the PHQ9 are more specific ones, meaning these are the 2, to be honest, that I personally use in my practice, mostly in a behavioral health clinic, community mental health clinics, psychiatric hospitals, drug and rehabilitation clinics, and so forth. So what is PHQ-2? So PHQ-2 is actually very similar in terms of duration. So over the last 2 weeks, how often have you been bothered by the following? Even the answers are quite similar with the other screenings that we just talked about. It can be not at all. It can be several days, more than half the days, or nearly every day. So the first question that corresponds to PHQ-2 is, so for over the last 2 weeks, Nanay, how often have you been bothered by the following? Little interest or pleasure in doing things. Second is feeling down, depressed, or hopeless. So as nurses, what we want to do is we want to always make sure that we know our clients understands the question and the answers. Second, health literacy is very important. So meaning you want to make sure that you use the language that they're using in layman's terms. So you can always substitute depression or hopelessness and explain it more thorough for them. At the bottom is the interpretation. So a PHQ-2 score ranges from 0 to 6. If the score is 3, that is the cut point when using the PHQ-2 to screen for depression. If the score is 3 or greater, major depressive disorder is likely. Fourth mental health screening that I want to discuss is the PHQ-9. Again, very similar with the GAD7 in terms of duration and in terms of the answers. So over the last 2 weeks, Nanay, how often have you been bothered by the following? First is a little interest or pleasure in doing things. Wala ka ng motivation to do things. Hindi mo, dati si Nanay likes cooking, now hindi na siya nag-cook. Parang ayaw na niya mag-cook. So that is the interest and the pleasure. Second is feeling down, depressed, or hopeless. Third is trouble falling asleep, staying asleep, or sleeping too much. So it can be hirap na hirap si Nanay makatulog. It takes her about 2 to 3 hours to fall asleep. So trouble falling asleep. Hirap na hirap si Nanay na matulog ng diretso. Si Nanay will wake up multiple times at night. And third is si Nanay natutulog 10 to 12 hours or more than that, or sleeping too much. Fourth is feeling tired or having little energy. So let's say Nanay had was able to sleep for about 8 hours for maybe 2 consecutive 2 weeks every night, but then she always wake up tired, functioning, parang hindi siya energized. So that is the feeling tired or having little energy. The fifth one is poor appetite. So si Nanay doesn't have any appetite. Dati magana siya kumain, ngayon parang I don't care, I don't want to eat. So that is poor appetite or overeating. Sixth is feeling bad about yourself or that you're a failure or have let yourself or your family down. 7, trouble concentrating on things such as reading the newspaper or watching the TV. 8, moving or speaking so slowly that other people could have noticed. And ninth, thoughts that you would be better off dead or hurting yourself in some ways. Again, I want to emphasize, nurses, that we always want to make sure we consider the client's health literacy, consider their mother tongue, and we want to make sure we explain the questions and how they can answer it, for us to be able to do this effectively. At the very bottom again is the interpretation. So total scores of 5, 10, 15, 20 represents cut points for mild, moderately severe, and severe depressions, respectively. Question 9, although is a single screening question on suicide risk. A patient who answers yes to question 9 needs further assessment for suicide risk by an individual who is competent to assess the risk. So this is a very good and decent table for you guys to always be reminded about the answers. And of course, we have sources here, and also we want a cite or we want to know who made the tool. Okay. The last on my list under the mental health screening is the PTSD-5. So the primary care PTSD screening for DSM-5 is a screening tool designed to identify persons with probable PTSD. Sometimes things happen to people that are unusually or especially frightening, horrible, traumatic. So for examples, serious accident or fire, physical sexual assault or abuse, earthquake or flood, being in a war, seeing someone being killed or seriously injured, or having a loved one die through homicide or suicide. So rule of thumb in any traumatic or abuse cases, you always want to ask, was there any physical abuse growing up or at present? Is there any sexual or being molested growing up or at present? Is there any emotional or verbal abuse growing up as a child or at present? Any accidents, death in the family that you struggled the most, including hospitalization or sickness? Also, fifth is we also want to make sure we ask anyone died in the family or losses in the family that you struggled the most. So trauma encompasses a lot of things, and we want to make sure that we understand that one. So the question is, in the past month, how have you had nightmares about the event or thoughts about the event when you did not want to? So yes or no. That's the answer. Second is, have you tried hard not to think about the events or went out of your way to avoid situation that reminded you of the event? So, so avoidance behavior. Third is, have you been constantly on guard, watchful, or easily startled? So hypervigilant or easily startled. Fourth is, have you felt number detached from people, activities, or your surroundings? So aside from having that avoidant behavior, we call it detaching. You're detaching to the event or the people around that. And then lastly, have you felt guilty or unable to stop blaming yourself or others for the events or any problems the event maker? So yes or no. For the interpretation, so current research suggests that the results of the PTSD-5 should be considered positive if a patient answers yes to any 3 items. So here's the sources. So just a recap for this section, we talked about mental health screening, the most common mental health screenings. First is the GAD-2. Second is the GAD-7. Third is the PHQ-2. Fourth is the PHQ-9. And then lastly is the PTSD-PC PTSD, number 5. So again, I just want to emphasize that as nurses, we always want to make sure we practice within our scope. As nurses, we need to always be assertive, meaning we work hand in hand with other healthcare professionals as collaborative care. third is we always want to make sure that we understand the client's level of literacy, mother tongue, and we want to make sure that we know how to explain not only the questions but also the answers. Sixth is just emphasizing that all of these mental health screening tools doesn't mean that we can diagnose any disorders. Also, I'm not in any way affiliated with the National HIV curriculum or with this website. This is just for me to better explain this mental health screening for you guys. And with that being said, thank you and have a nice day.